Good afternoon, everyone. Gareth Presh, founder, CEO of the World Health Innovation Summit. Sorry there at the start, we had a little bit of a technical problem. I had the screen run loop. I am delighted to stand in here. Can you hear me okay, David?
I can hear you. I can hear you.
Yep. You too.
I think Julie was saying she just can't hear me at the moment. But let me just crack on there for a second. Delighted that you could join us here today for our latest edition of Talks. I'm standing in for Roxanne today, and I'm really looking forward to discussing AI, and particularly around women's health. And we have a fantastic group of individuals here who are pioneers in their respective fields. We have David, of course, from WHIS Ireland, Julie, who's in London, and Maria, who's all the way over in the US. And it must be quite early. Is it early where you are, Maria?
Yes, it is.
Okay, well, you are very, very welcome to join us today. So I think we've just lost Julie, probably a little bit of a technical fault. But let's just do a round of introductions, and I'll hand over to Maria. And Maria, the floor is yours.
Great, Gareth. Thank you so much for having me. I'm Maria, the founder of FoXX Health, and my background comes from being a patient in the space. A few years ago, I went through my own health scare that had to do with my heart, and I was unable to receive clarity, receive a diagnosis, and not having a medical background myself, I felt overwhelmed, frustrated, dismissed, and come to find out that is a world shared experience for women. And I set out to help rectify that problem with FoXX. So building FoXX, I opened the company in 2024. We launched at the end of last year, and we've been bringing women to the platform, helping them every single chance we get, building new features. So I'm excited to talk more about the landscape, FoXX, what it looks like now, and what the future looks like as well.
Wow, fantastic. And let me just jump all the way across to London. Julie, another pioneer in the space of women's health. Julie, over to you for a short introduction, please.
Hi, Maria, and thanks so much for being with us. I am the political strategist and community. I'm very much a community lead, and we work within the space of WHIS, supporting the development and the issues raised throughout health. And today, as it's around women, it's great that I'm here as a panel member to support the discussion.
Thanks, Julie. Absolute pleasure to have you with us. And Julie has been, doing a lot of pioneering work in London for many, many years. Great supporter of the work we've been doing from day one. And let me now introduce David, who's all the way over in Ireland. David.
Thanks, Gareth. Look, fantastic to be here today. Really look forward to what we're going to be covering today. Very exciting. For about 15 years, roughly, I've been working in digital transformation with organizations, now specializing through the Sustainable Value Collective to help enable true, real, sustainable transformations through organizations through digital functionalities, culture, governance, lots of elements there. But I have dabbled through the years in the healthcare space, Maria, in helping drive digital transformation progress here. So really looking forward to some of the points we're going to cover today.
Yeah, I think we're in, we've got such a broad scope of the agenda today, and it's going to be mainly focused on women's health. And I think that's why it's very fitting that I just hand the floor over to Maria straight away so that we can get into the deep dive discussion. If anyone is tuning in and wants to, pop a question in the chat, by all means, if you've had an experience yourself with health systems around the world, if you believe there's an opportunity to change, let us know. Remember, the focus of our work is around prevention and to give people the tools to manage their own health and well-being. Hence, the forum today is to give people, the patients, the community, the voice. So please do chime in, get involved, and check out what we're doing. So with that said, let me hand over to Maria. Maria, the floor is yours. Please give us an insight into your world and what you've been doing over the last couple of years.
Absolutely. So FoXX Health is doing exactly what you just mentioned. We are trying to give women the tools they need to not only take back control of their health, but prevent our health from worsening to the point where misdiagnosis takes place. It takes such a long time to diagnosis and ultimately be more well-informed. When I set out to create FoXX Health, I took time to interview over 200 women, both on the clinical side and the patient side, about their experiences. And one thing always came forward in the conversation, and that was the actual conversations women were having with their doctors. I have a fundamental belief that doctors went into their profession to help. That is only untrue by a very slim margin, and I choose to believe in the good. So with that, I created a tool not to replace doctors, not to replace the work they're doing, honor and respect what they set out to do in their profession, but ultimately enhance the experience by giving patients the tools they need to have a better conversation with their doctor. What that looks like on FoXX Health is a full body symptom tracker that no longer ignores every part of the body except our reproductive system. Women need better tools to better connect the dots, understand how different diseases, how different symptoms are showing up for themselves. For example, for so long, as we all know, women have been left out of clinical studies and the data lends itself to male bodies. But ultimately, how we are being diagnosed as women, whether that be with endometriosis, with cardiovascular disease, those symptoms also show up differently in women everywhere. So by giving ourselves our own data, we're also understanding that symptomatology that women also don't have a record of. So by logging your own symptoms, by correlating your data, by showing up to your appointment, and instead of saying, you know, doc, my head hurts, you can say, I'm here because over the past 3 months, I've had migraines that are onset by movement. That is going to radically change the conversation to help reduce the time to diagnosis as well as the misdiagnosis rate in women, ultimately helping us take back control of our health by working with our doctor to solve these issues.
Mm.
There's incredible stats that you're making there. Sorry, Jay. Julie, do you want to jump in? Go ahead.
Yeah, no, I was just going to say it's really, really interesting this because being a woman, because I've got lupus and other impairments, you go to your GP quite often. And like you say, Maria, you know, that as we like to see the positive in why we go to GP because we want the good outcomes. But for me, I think it's been really, really difficult. It's been a difficult journey for most of my life because I don't think that people really or GPs really understand certain conditions, and you do need to go tooled up with your information if you can, if you're able to. But there are many people that can't do that, don't know how to do that. And they're the ones that really concern me, really, because I think everything you're saying is spot on, and we should all try to follow that kind of acumen. But in the same way, it concerns me about who can't do it.
Yeah, well, I think there's quite a few points you've touched on there, and I think
Mm-hmm.
the first point I want to talk about is sort of the dismissed symptoms. So I think when you mentioned that, Julie, so I mean, for example, you have 1/3 of women report daily physical pain, often dismissed by providers as natural, right? So this is a huge problem. You just touched on it there. A couple of other things which obviously lead into that. Then, of course, then you get workforce loss. So poor health is the leading driver of economic inactivity, missed work for women. So the sort of symptoms here are really wide and diverse. But you can also see the opportunities then to improve health and well-being across the spectrum by delivering the tools that you're talking about, Maria. If we look at mental health, young women disproportionately experience common mental health disorders, anxiety and depression. And one of the things that I'm pretty, one of the areas I'm very focused on at the moment is around patient safety, which you touched on. We look at maternal mortality for Black women. They face up 4 times higher pregnancy-related rates in many regions. So that's a huge challenge. And the point you touched on, Julie, around delayed care, later than men, across 700 different diseases. So this is like really, really serious problem. And I know, David, you'll like this stat, and Maria, the statistics around data exclusion as well. So only 5% of clinical trials, you know what I mean, are related to this sort of data. And that's a huge problem. So when you look at that, you add in the research challenges around less than 2% of private healthcare funding goes towards women-specific conditions. Like, look at the size and the scope. And then when you factor that all in, the economics behind it, you know what I mean, is $1 trillion. Like, that is huge. So, you know, and then what does that lead to? It leads to life expectancy. Women live longer than men, but they spend 25% more of their lives in poor health. I mean, these that we've just gone through there, I mean, they are shocking, you know. So, I mean, the opportunity for me is, like, when we look at this, is looking at yourself, Maria, the sort of innovative solution that you have come up with. It's being able to give you that springboard. I mean, David will be able to talk a little bit about the Sustainable Value Collective, which we've gone live with. And we're basically building an infrastructure to support the founders like yourself with the big hitters like Microsoft and others. Because what we've done is we've managed to bring an infrastructure behind us to be able to support WHIS on a global level, to be able to springboard all these ideas all over the world. One of the exciting things, which I was going to talk about later, was we're going to launch WHIS Talks in Chicago, right, in the US. So this is the start now of the chapters beginning to start their own process. So, I mean, Maria, from your perspective, when you see those numbers, you know, look at this one here. If we bring this one up, right, you know, this is a huge number, right? How do you see yourself, FoXX Health, tapping into that as an opportunity?
Absolutely. Well, I want to point out here that the opportunity here isn't to necessarily just get women back into the workplace. I think that the opportunity here is for us to understand our health so we can better show up for ourselves. If we know what our symptoms are correlated with in our own body, we're better able to take care of ourselves. Women in, you know, the workplace, in the workforce, needing time off, women are also more efficient. There are also statistics that show that having a woman in leadership leads to better outcomes in the long run. I think that it's important to note that women living 25% longer than men, but they're more in pain. That statistic that you showed is not just a lesser quality of life, but imagine showing up just to have a meeting with someone and you're in pain. You know, we spend holidays not knowing if we're going to be in pain or not. We are still expected to show up. And that, I don't think that that is anything that has to do with men being against us. I think it has to do with the data not supporting us. And this goes back to, I do believe doctors want to help, but where they fall short is even the research they were trained on lacks the support for women. So they aren't going to diagnose blind. They know that what they need to do is dig deeper into it and try and find evidence. So I think everything that you're showing really supports that women showing up for themselves and saying, here's my full picture, and move forward is going to help close that gap more than anything, ultimately leading to more efficiency through that self-knowledge, that self-ownership, working with that doctor. So I think the opportunity here is actually to use FoXX in the sense of, I need to know my body. I need to know my health. I need to know what's going on so I can show up better for myself.
So I think you're making a crucial point here, and this is one of the things that bring David in now around data, the Sustainable Value Collective. We had a call yesterday with the team, and you know, putting that infrastructure in place, David, within the community setting now. This is what we're talking about. This is a whole new space. Like, so in the preventative healthcare space, we're talking about bringing care closer to home. David, maybe you could chime in and just give an insight into sort of what the plans are and how we plan to scale this up around the world, you know, with the Sustainable Value Collective.
Yeah, look, a key element of social prescribing, driving healthcare to become more proactive rather than simply reactive, which can save billions for governments globally. But more important, although somewhat sometimes not focused on, but the more important element, can save lives. a vast number of lives also in that respect. A key element of this is having that social platform ready at a community level. And the important thing to realize, and I'm sure you've seen this yourself, Maria, in your work with FoXX Health, that the technology is available, the fundings are available, the people are available. It's being able to draw those dots and bring this together to enable the progress needed in certain areas. So getting back to social prescribing, what we're trying to do through the Sustainable Value Collective, we're creating these platforms at community levels where we're bringing mental and physical health providers at the local community level together to show that if we want to move to that proactive model of healthcare, the means, the necessities, the functions, the initiatives are there to provide those services to help keep us healthy in the first place and focus more on remaining healthy. We'll never remove it, of course, but rather than stopping people getting ill in the first place, so it's not that purely reactive form of healthcare there. So, I mean, elements such as FoXX Health are critical when it comes to that. And I mean, getting more onto the technical side for a moment, I mean, I did work before and as part of the Oracle team. We worked on the Better Births app for the NHS, which was helping women go through the maternity journey with the hospital rather than just sitting in waiting rooms. And I've been there. I have 2 children. I was there the whole time with my wife, sitting in waiting rooms full of over 100 people waiting for a couple of hours for your appointment, but it's more enabling that journey and keeping you fully informed so the woman, the mother to be, understands the whole way through that, helping to deal with any difficulties and challenges, and then the follow through after we have the new baby as well. Now, that is particular to dealing with going through that process, but FoXX Health is far more grand in tracking your health as a holistic picture. So how do we help enable that so that the user themselves can interact, understand, okay, I need to look at this, I need to look at this element, I need to feed the information, the data that I have about myself in to correlate with the app for FoXX Health? I'd be really interested to know more about that.
Well, just before you chime in there, Maria, I wanted to ask Julie, because Julie, you've been doing local work, bringing in the communities into this space. That's what we need. We have to empower the communities. I'd love to get your perspective on, like, how do we bridge that gap? I know you're doing the community circles with Start Change. Maybe you could explain to the audience, what does that look like in practice? Because you've got to bring the people together first and foremost.
Yeah,
you've got to build the community, and then build the trust to enable FoXX Health to, to support that transition. Maybe tell us what you're doing.
Well, community circles within itself is a structure that is will be in each local area across England. It will be a collective of it. It will have within it not just communities, but a collective of housing, lead housing officers, health, housing, health, social care, etc. And people will come together just to talk about it. It won't be one of these moaning places that people can go to vent out their anger, but more so somewhere where they can have conversations about their health, about their well-being, about where they live. And it could be where they live that's making them feel so unwell and affecting their well-being. So it's a place where people can go have the conversations. The conversations get brought back to political figures in their area, and those political figures take it back to Parliament so that the voices and views are heard from a direct line. Now, what's currently been coming out in one particular area, and I won't say which one because it's a very new one, but what's coming out is that a lot of the voices are coming from the maternity sphere around Black women with babies, maternal care. But at the same time, things like blood pressure and like hypertension and cardiovascular disease and things like that is being raised, whereby people are not being diagnosed soon enough. And that's been at the detriment to their whole well-being. And 2 women have passed away because of that. Family have said.
It's startling, the numbers. I mean, when we look across the health service and the context in the UK, you know, we've 2.5 million people with ill health at the moment, costing the UK government about 7%. It really is shocking. I just want to say to the audience, because I've had a couple of people message me say they're struggling to pass comment, but just try your best. I know there's some comments on LinkedIn. I'll just show you. So we have Subra here who said great insights, so that's fantastic. But if you have a question for any of the panelists, please do pop it in the chat. Let me just go back to Maria. So you've heard about the community circles, you've heard about the infrastructure from the Sustainable Value Collective. Can you just, where do you think we can pull this all together? Like, I mean, where does FoXX Health come in?
I think where FoXX Health comes in, especially in the community, is understanding that your health is personal, but the experiences we have are shared. Exactly what Julie was just speaking about when it comes to maternal mortality rates, or even just maternal health in general, what happens in each woman shows up differently based on a number of factors, but race and socioeconomic status, pre-existing conditions, those only give you more information in that picture. And I think community here is such a focal point for health. Last year, Reddit was the #1 growing social media discussing women's health. So what we did in FoXX is create a community feature called our Community Den. Women are able to go in and speak on a number of different topics, whether that be maternal health, gut health, bone health, general health, and speak to other women. Shared experiences have, in my opinion, kept us alive in a system that hasn't previously had the infrastructure to truly support us. So community systems here on that person-to-person level, speaking with other women, I think is a non-negotiable as we continue to build the healthcare system back up to support women properly.
Yeah, and I like the way you said there, bring the health system back up to support women properly, because clearly we have a serious problem. I mean, let's be under no illusions here. We've had a number of maternal scandals, which are rising on a sort of yearly basis here. The litigation costs for the health service are enormous, and unfortunately, I believe this situation will only get worse. We really have to pivot and have a paradigm shift and really empower women to manage their own health and well-being. When you look at the statistics which we brought up earlier, I think one of the statistics that, let me just go through it here, was something like, what is it, 2% was it, that in terms of the investment. I mean, it really is staggering. The sort of, here it is, research, less than 2% of healthcare funding goes towards women's specific conditions. I mean, in this day and age, in 2026, I mean, how can anyone, we all have mothers, daughters. I mean, I have 2 little girls. I mean, this statistic is shocking. Like, we really have to do something about this. Let me just go back across to David. David, we're talking about technology here. We're talking about, empowering people and enabling people. There's a lot of fear around technology as well, so how, Julie's talking about building trust in communities. How do we get over that fear, and encourage people to get involved with digital, and at the same time we have to respect people also. They don't necessarily have to take on the digital. We have to be able to do all. We have to make sure we're inclusive.
Absolutely. I mean, the inclusivity is one of the most key elements when it comes to utilizing technology. We have to understand there are older patients, there are vulnerable patients who don't have full capability to use that technology. So that these are means that need to be met. But I think the largest element there that we've touched on throughout the talk so far comes back to trust. Security for the health data in terms of online security for hacking and data loss, but even just trust for the people at home that are using that. Because when you hear talks on the news about digital IDs virtual currency, all of this, straight away people are going to say, whoa, I'm not going to give myself up 100% digitally like that. So people are very cautious about moving forward with that. And I think the best way to help people understand and feel more secure in that is through elements like FoXX Health, step by step, utilizing an application bit by bit to understand that when we do use these services fully and to our best benefit, it really does. The difference is staggering. And I mean, it's not just that it enables doctors to deal at scale with more patients. It's not just that it enables people to be more interactive with their doctors, but it's the fact that it does it holistically in that regard. So, I mean, it's bit by bit stepping into using technology gradually, understanding that when we trust and when we share with the data that it is for our use, and when we have elements like FoXX Health that do have that security at play to help us, whether it's communicating with GPs, with pharmacies in relations to having that complete circle when it comes to communications. We have to look at the picture holistically in that sense. To understand security, it's not there for hospitals, but for the user as well.
Yeah, the trust is critical. That's why I wanted to go back to Julie, because I think, Julie, your expertise in the community setting, how do you build that trust? Like, I mean, that's a fundamental question, because I think if we look at the statistics over the last couple of years, trust in the health service has been plummeting, particularly since the pandemic, and we have serious problems. So maybe, Julie, could you give us an insight? How do you build that trust back up?
I think that's a really, really difficult question, because everybody kind of feels trust is a different thing for everyone. But I would definitely say my experience on how people use the service, a lot of it is around trusting those who aren't clinicians first. And I know that may sound a bit odd, because you should be able to trust your clinician 100%. However, people will trust a peer support worker, a social prescriber, an advocate, and that trust will come with them opening up a lot more information. And it's information that if a social prescriber said, can I share this with your GP? The individual won't mind doing that, but it's that initial trust thing. Can I go into my GP, say everything I'd like to say, and get the answers I'd like within 8 to 10 minutes?
Well, you're touching on such an important part, especially like when you look at trust. And I've been, fortunate enough. I've worked in, the haemophilia groups that I've worked with in Ireland, contaminated blood products, HIV and hepatitis C. You've got to really build that trust by being open and transparent. You really have to be values led. I think we can be fair. Like, it is fair to say, look, the health service has a problem with transparency, integrity. The trust is eroded, and we have to work hard to build it back. But I believe by going into the community, you can build that trust back. You can get out there, and what we're doing at the moment in terms of opening the conversation, getting out there, being involved, co-creating. I mean, these are significant opportunities to build trust. I think we've got a lot of work to do. Maria, when you look at sort of what you've done over the last 2 years, maybe you could share some experiences that you've had within the health ecosystem. The question is, do you feel it trusts you? Does it give you the support from an ecosystem perspective? Because clearly you're coming together with a solution that can support people's health and well-being. Do you feel you've had enough support? I mean, I have this on a daily basis when I talk to a number of innovators who have incredible solutions, but they can never get the funding. They can never get the support. There's always, in terms of like, we're pitching to the hospitals, so how and that's not a good forum either. We need to look at the paradigm shift where the opportunities lie. Maybe some insights from yourself, Maria.
Yeah, absolutely. In order to give proper insights, I want to touch on something Julie just said about the lack of trust. And that comes from what Julie had said about we're not getting the answers we like from our clinicians. And I think the reason why is because when we go in to see a clinician and they don't have the information that can support a diagnosis, a course of treatment, or they need you to leave, track your symptoms, and come back if the issue's still there, why would we go? We're going in and we're frustrated and we're not leaving with answers. We're still leaving in pain. And I think the answers we like would be solutions. And that is hard to get to, especially in a first meeting without supporting ourselves. And to tie that in, Gareth, a lot of innovations I've seen in women's health have come down to self-testing kits and healthcare options, and how we have different telehealth providers now as well that are women specific. It's about accessibility. It's about owning our own data. And I think that's exactly where FoXX jumps in, because even with the self-testing kits, you look at the kits that you can take home, do a full blood panel, send it in, get your results. But then what? How does that show up in our everyday life? How do solutions actually make us better? And I think FoXX bridges these gaps. It's not a moment in time snapshot. It's continuous. It's real life. And for, reasons that piece of the feedback FoXX has gotten, that isn't a big enough piece. Because we're going direct to consumer, we like to keep FoXX at an affordable price, because healthcare systems also fail us. If, it's a whole other podcast talking about the business model of healthcare. But in some, FoXX Health is going direct to consumer, which is a turnoff to investors, because they're not immediately going to make that money back as much as this truly is going to make that difference. I also want to touch on the technology piece that we talked about earlier with AI. AI is definitely a conundrum when it comes to health, because it's so innovative and there's so much opportunity, but the majority of AI is not there yet. And we see in multiple different examples how it's not scalable. And with funding specifically, you have to have AI. But then when you look at the research, AI can also be your demise. So at FoXX, AI isn't the point of the tool. AI is supplementing what you're doing. FoXX Health is not diagnosing you. We are not giving you a diagnosis to take into your doctor and say, is this right? We're giving you your patterns. We're giving you insights. We're using licensed data that isn't just open source, going to ChatGPT, which has been shown to be less than reliable in health situations and conversations. But ultimately, talking about AI and how this is moving forward, I think that we've come so far, but we still have so far to go before AI can actually transform what we're doing on the levels that we want it to and need it to.
Yeah, very true. And you're talking about behavioral change. So look, we have about 7 minutes left. And what I want to do is give everyone an opportunity to sort of so firstly, if anyone else has any questions, pop them in the chat. There's a couple of, I'll bring one. I think Subra has asked again. It will be recorded. Absolutely, you can share this as a resource. So, that's fantastic. But let me sort of ask, the three of you a couple of short rounded questions, shall we say, and I'll come to Julie. Julie, we touched on trust and we talked about building, that within the community setting. What needs to happen? So what do we need to be doing in the future? And then are you optimistic for the future?
I am optimistic for the future, because I think that, like what Maria's coming with to put on the table, what FoXX has got is extraordinary. So if we could have more of that, I think that it can leave people optimistic. My concern comes with things that people that don't feel optimistic about the future of their health.
Mm-hmm.
And that could be because they're just not getting the right support that they need, something that I said earlier. But I think that it's time that whether we trust or don't trust, we have to rely on the NHS or clinicians. We have to, because that's all that's there. But some communities will not. Some communities will rely on cultural medicines.
Yeah, well, you make such an important point here about, like, so the optimism, because that has a profound effect on, your outcomes. So, I mean, it's really important to make that point. And I think it's important to understand the context here that we have 4 billion people around the world that don't have access to healthcare. This is an enormous problem.
Yeah.
So I wanted to kind of pivot and go to David now, just for in terms of David, how do we facilitate that change through the Sustainable Value Collective? And also, like, what you're doing in WHIS Ireland, how you're building out the platform there as well. This is what the collaboration is about, having that platform where communities can build, as we've just discussed over the last 35 minutes. And are you optimistic for the future?
Always optimistic, never nothing but. The only way to get anything done. But look, I think it's important, as I've said, to understand sometimes some people can feel lost in this regard into some of the pitfalls that we're in right now with healthcare systems, governments around the world and stuff. How can we do something? People have to understand the technology, the people, and the funds are all there. It's a case of building not just a digital platform, but building the community platforms to bring these services together for people to communicate, most importantly, to share and educate each other and how we can enable this. And that's a large part of what's behind the Sustainable Value Collection, the SVC. We're trying to create that platform where people can share knowledge, expertise, how we can make this progress, then get together, understand how we can work in that partner ecosystem to really push and drive impact and change that's needed for this day and age, really.
Yeah, thanks, David. And I think, like, we're coming to the end. We've just got a last, like, so we say 2 minutes, and I think it's been a fascinating discussion. I'm gonna just ask Maria just to come back in. Maria, from your perspective, you're talking about your entrepreneurial journey here, which has been fascinating, and is something that I really enjoy, is being able to listen. But also, the key point here is to listen and learn from the frustrations that you've had, and because for someone like myself as well, who's been an entrepreneur, who's also trusted people, who's given people enormous trust, I understand what that feels like, in terms of, like, when you are let down. But importantly, the most important thing is to keep going, and no matter what, just don't stop. I had a very wise professor who was a mentor of mine, and I had some challenging times in the past, and he just said to me, "Don't let them get your head down, and just keep moving forward." And that's very true, because stick to your ethics, stick to your values. That will always show through. Maria, going forward, as you come to the end of the podcast here, are you optimistic for the future for with FoXX Health? Given the state of play that health systems all over the world are under increased pressure. But what we're trying to do here with the World Health Innovation Summit, the Global Social Prescribing Alliance, the World Health Service, which is our donor advisory fund, we're trying to pivot the system, change the paradigm, create a new market around prevention, and bring investment into, support yourself and others to deliver health for all. So over to you. What's your thoughts?
Yes, absolutely. Well, my thoughts stem from my core belief that optimism and positivity take discipline. It's really easy to not be optimistic and to not be positive. And it takes a choice to retain both of those thoughts. I think that I am optimistic and positive because organizations like yours exist. I also urge organizations like yours to take steps. It's one thing to be an organization and have mission and talk about the issues. It's that next step forward, how we are acting on it, that will really make a difference. And I truly believe that you are, and there are a lot of organizations out there that are, but even the small steps, billions of dollars of funding is great, but what about the founder who needs $10,000? Those are just as important. And I think that it's, something to look forward to.
Well, that's what we're doing, because we're not sitting on our laurels. I mean, David, Julie, myself, we've been working on this for many, many years. And if anyone's watching this from the investment community, do reach out to myself, because we have a donor advisory fund. We're taking action. We're not messing around. We want to support. We want to be. We basically want to have portfolio companies to support Maria and other founders around the world. That's our plan. We have a very structured way to go about that, and we're executing that plan. We have the 1% health pledge, for example, where we're working with corporates that can come in and donate, for example. There's plenty of funding available, as David has articulated, and I know myself. So look, this is an exciting journey. We're not here to talk, we're here to do. So with that, and on that note, I will end this podcast. But look, thanks for joining us. We'll be with you soon. Just a couple of points to make. 17th of July, we have our Global Social Prescribing Alliance Summit. Please do join us. That is one not to be missed. A full day. We'll be talking social prescribing, implementation, you know, all the digital tools that go with social prescribing that we're building out with our partners through, you know, the Sustainable Value Collective. But also we'll hear stories, you know, success stories at a local level and how we scale them up. And then also the funding. So how do we bring that funding to, you know, as Maria says, how do we actually make that happen? So we'll go through that as well. Finally, next month as well, we have our special interest groups on social prescribing, and you're more than welcome to sign up to that. You'll find the details on our webpage and on our website. So from myself, Julie, Maria, and David, we will sign off. Have a fantastic afternoon and the best wishes, and stay optimistic, as people say. All right. Thanks, everyone.
Absolutely.